Now, the Omicron surge is continuing to set new records across the U.S. More than 66 million Americans have been infected with COVID-19. More than 851,000 of them have died. Now, the nation is recording more than 800,000 cases each day. This is for the first time since the start of the pandemic. However, after weeks of soaring infections, areas that were hit earliest by the Omicron variant are starting to see cases drop. But experts warn this latest wave isn't close to being over just yet. Mola Lenghi reports from New York City.
As Omicron continues to sweep the nation, today Dr. Anthony Fauci addressed whether it could end the pandemic.
I would hope that that's the case. But that would only be the case if we don't get another variant that eludes the immune response.
Still, health officials say the next few weeks will be rough. As case numbers shatter records, more than 133,000 Americans are currently hospitalized with COVID, down 2.5% from the peak the week before. And the challenges continue tonight with the lack of available rapid at-home tests and long lines for PCR tests, topped by lengthy delays in getting results, contributing to the spread of the virus.
Tests allow us to make decisions about whether we're contagious and so a threat to others, whether we can safely return in person to school or to work.
Meanwhile, New York State could be turning a corner on the surge, recording about 48,000 cases on Friday, a nearly 47% drop from roughly 90,000 cases a week earlier. Other states in the Northeast are also seeing a downward trend or leveling off. In the future, experts say coronavirus may reach the point where it becomes an annual illness, like the flu.
This is going to become an annual vaccination, at least for a period of time.
A new Israeli study suggests that a fourth dose of vaccine provides only limited protection against the Omicron variant. Today, Dr. Anthony Fauci said we need not variant-specific vaccines, but ones that protect against all strains of the virus. Errol?
All right, Mola Lenghi, thank you. For more, I want to bring in Dr. Maria Elizabeth Ramas. She's a family medicine physician. Doctor, welcome. And I should note to folks who regularly watch this, which is everybody, the last time we had you on this program was back in November. There were still no known cases of the Omicron variant in the U.S. then. I'm just wondering, I guess not if you're surprised, but how surprised you are that this strain spread just so quickly throughout the country.
Well, it wasn't anything of a surprise. We've been through this once before with Delta, and I do want to thank you for having me on here today. We've been through this once before with Delta, and our friends across the pond in England and in Europe definitely were able to give us a heads up with what we were to expect here. What is unfortunate, however, is that I believe that the Omicron variant itself is going to linger a lot longer than our friends across the pond in Europe and in Asia. And that's partly because of the confusing way that we have gone about in protecting our citizens and our members in the United States from the variant itself. And we can go into that further.
Well, that's exactly what I want to speak about, because despite those early warnings from overseas, medical insurance only just started to cover the cost of tests this past week. There's still a lack of availability. It's difficult. You know, the updated guidance on masking has just been issued. The same with quarantine rules has taken place over the past month. I'm just curious on where you believe the U.S. may have, if in fact you do believe so, fell short in responding to something we knew was coming.
You know, this is where public health has become personal. And we are in the midst of being nimble, of having to be nimble and having to pivot quickly. What's getting in the way, unfortunately, are the naysayers and those who are not taking science at its word. It is of utmost importance that we are giving our public health officials and our healthcare professionals the leverage that we need in order to do what we know works best for our patients, and that is treating with evidence-based treatments, providing vaccinations and reducing barriers to vaccinations, and if need be as well, getting tested. Unfortunately, we were slow to getting that done in a uniform fashion across the United States, and we're reaping the repercussions of that.
And meanwhile, doctors like yourself are absolutely burned out and exhausted by now. Your state of New Hampshire has seen an alarming surge of COVID-19 cases and hospitalizations. And even if some of the cases aren't as extreme, it's taking up the space where other patients may need other services. I'm just curious if you can give us an update. What are you seeing on the front lines in your state right now?
Unfortunately, in New Hampshire, we are beyond capacity. Our hospitals are hemorrhaging because we are not only taking care of patients who are vastly unvaccinated in the ICU from COVID infection itself, but we're also trying to deal with the everyday cases and emergencies that are inevitable at this time of year. Our pediatric cases of RSV, which is a respiratory infection that is very common at this time of year, are still on the rise and tend to be more advanced compared to other years. We also have regular emergencies like the heart attacks and the strokes that we're not able to take care of in an appropriate fashion. I have patients that are being shipped up north to Dartmouth Hitchcock or down south to Boston because we just don't have the room. And on top of that, we have a shortage of healthcare professionals to do the job that we know needs to get done. It's really grave.
I can see that. We've experienced it in our reporting. I know you lived this. The CDC is facing a lot of criticism too, simply over its communication. A recent CBS News poll finding 57% of Americans say the information on COVID from health officials has been confusing. That number was 47% back in October. I'm curious, what kind of feedback are you receiving from your patients when they speak about this, and what do you tell them?
One of the things that I'm very grateful for is that we have a close-knit medical community here in New Hampshire, and every patient, to my opinion, needs to have a family physician or a primary care clinician who they trust for this reason. We are in the midst of watching science in action, and it's important to have a trusted medical team that patients can go to get information that they know that they can trust and make decisions to their best knowledge. On top of that, we're seeing a lot more local medical communities stepping up to the challenge of trying to disseminate information that is both trustworthy and evidence-based in a culturally sensitive way. And we're doing that here in New Hampshire through the Lighthouse New Hampshire Facebook group as well for our, particularly our citizens here and our graded staters who are of the BIPOC community, Black, Indigenous, or persons of color as well. And so we're starting to see more grassroots efforts to get the message across in a way that is trustworthy.
Well, it's clear that this essential work doesn't seem to end. Dr. Ramas, thank you for joining us. Thank you for doing what you do, and we send you all of our support, our thanks, and our strength. Appreciate your time.
Thank you.